Well, hello, everybody. Welcome to another Friday night. It is 5 o'clock somewhere, so we're going to get going here tonight. My name is Dr. Lee Osler, one of the co-hosts of the Redox 5 webinar that is every Friday night, Saturday morning, depending on where you are at. I am in the state of Washington, in the United States, and my co-host tonight is Dr. Ray Dixon. He's coming at us from Phuket, Thailand. He deserves some special love tonight. He just leveled up. He's now a double diamond. And so we honor him and respect his acumen and his expertise in all ways. But he's been with us before as a host and a guest on Redox 5 and is probably one of the top 2 or 3 people in all of the world of ASEA, in my opinion, as to who knows what this is about. So we honor and respect him. We're joined also tonight. We want to excuse Dr. Maureen Hayes, who's just traveling and getting back into the country. And so she's out, and Jim and Ann Glenn are absent as well, away with some family activities. We have tonight as our guest Nelda Castillo, who is a nurse from the central part of Texas. So we love having her with us, and she's always with us, as well as Dr. Steve Dalton, who I understand has something to do with Nelda being here as well. And we'll learn more about that tonight, I'm sure. So I want to kick this off, and with a disclaimer, we want to begin by saying that we are each individual associates of a company called ASEA Global. We are representing a cellular health product that is governed or regulated by the FDA supplement laws in this country, as well as all others. And therefore, we do not make any medical claims to diagnose, treat, or cure anything. We will not be speaking about medical diseases. We will be somewhat cryptic in this regard because our conversations are mostly about cellular health and wellness and how the cell functions. And so with that being said, I want to welcome Dr. Steve to our program tonight. I know you've been on before. I happen to have missed those, and so this is our first opportunity to be together on Zoom talking about this. And Nelda, I'm going to have you actually do the introduction here. You know Steve better than I do. Could you introduce Steve and let the world of Redox know who he is and his role in this? And then when that's done, Steve, I'd like you to come on and give your 2 cents worth, and we'll go from there.
Okay. Absolutely. Thank you. Thank you for having us tonight. So we are from Lubbock, Texas. We love Lubbock and we love helping people. And so I stumbled across these molecules, walked into Dr. Stephen Dalton's office. So he is a DO here in Lubbock, Texas, brilliant, very highly respected. He's been my mentor, my friend, my business partner. We do the workshops here in Lubbock. I love that we actually connected. But he's an integrative physician. He's into anti-aging. He's in private practice here in Lubbock, and he's in regenerative medicine. So very well known, renowned physician that is so compassionate, cares about people. And so I would love for you to welcome Dr. Stephen Dalton to our call this evening, ladies and gentlemen.
Thank you. Thank you. All right. So would you like for me to let you know how I got started?
Yeah, I'd like you to how did this come into your life? What was the experiences or the events surrounding that, just so that, because there's a lot of people that will be joining us tonight or will be watching the video, on replay who won't know who you are or where you came from.
Okay, well, I was at a world conference in anti-aging medicine in Las Vegas in 2010, actually. And Gary Samuelson was one of the speakers in front of 4,000 of us. And he spoke on redox signaling. And of course, he had to be cryptic also because he was not allowed to say the name of the product. But the science was incredibly wonderful, what he had to present. And I just had to find out about it. So I went and visited with Dr. Samuelson's afterward, found out about it, signed up, took it for 2 months. And I was in really good shape at the time, good health. There's still a lot we didn't know. And about 2 months after taking it, I looked at the back of the bottle and it said ingredients, salt and water. And I thought, why am I spending $32 for a bottle of salt water? So I quit at that time, and I certainly wish I had those 7 years back that I missed, because in 2017, I actually saw my first patient who had regularly taken it, and that's a moment I won't ever forget. This young woman had a condition that we still don't have treatment for, and through redox signaling, she was able to get off 11 medications in a very short time. I'm going to say the actual time is 1 week, and she is doing very well since 2017. I know her personally. She's a friend now, and she's still off all 11 medications. So that was my first experience with redox signaling in somebody who actually took it the right way and was consistent with it. And
were you, Steve, were you supervising? Were you her physician?
I was not her physician until she had been on it for 6 months and had her amazing result.
Yeah,
She walked into my office.
I just want to interject here, because there's going to be thousands of people watching this video who are going to walk away with the idea maybe that, oh, I can just stop my medications. And it's like, I just would say, and I'm sure you would endorse it, that it's like, that's not something you just do.
No, not at all. That is what she did on her own, and she did that 6 months before I ever met her. And I'm pretty sure it wasn't under her physician's supervision at the time, but it worked well for her.
Okay, continue on. That's very fascinating.
So shortly, when she came into my office and I saw that, she happened to present the scientific information that was just published the month before, and I said, I'll read it. And so she gave it to me, and I said, I'll read it and get back with you. Well, I read it right after she left, and the scientific evidence in 2017 TAR-A study was so convincing. I called her before she even got a chance to get home and said, sign me up. And I got an executive pack, the biggest thing I could find. And it's been history since then. I'm kind of morally obligated to share it. And I do share it in my practice. I use it all the time.
But it took you 7 years to get to that point.
Don't be like me. Okay. Don't be a knucklehead. We're all a little bit slow, and it's okay to be skeptical, but it's not okay to be stupid. So I missed my 7 years. I'm on board now. I don't need any convincing. I've seen far too many things. I know thousands of people, seen thousands of results. So I have no reservations.
That's great. So you saw her, you got signed up. Then what with you?
I just started sharing it with people, and literally sharing it. And people started getting involved, and I actually got my first check after the first week, and it's been every week since then. Hadn't stopped. There we are.
Was there any personal experiences or family?
That's a good question. So personal experiences, I've had a lot. I mean, there's some athletic, certainly improvement. There's the age reversal. I lost a number of wrinkles. I lost a lot of gray hair. My wife who's also a physician, had a very serious scare with her health, and she took it only because a dear friend of mine took it and got a amazing, miraculous result, and she ended up getting the same miraculous result. And let me tell you about my friend. He and I have been friends for over 20 years, and before he started ASEA, he was a fitness buff, and at 78 years old, he could do 45 push-ups nonstop, which is pretty amazing, okay, for a 78-year-old. But he'd been stuck at 78 for a year. And so I asked a gal who was 8th in the world in bodybuilding what would be a good improvement for my friend. And she said 46. I said, well, what about 50? She said, no, that would be a miracle. So I asked my friend how the ASEA was going, how it was working for him. And he said, oh, I'm not taking it. I'm giving it to my wife, and she's getting all the benefits. And I said, you saw what it does for athletic performance. Why don't you take it on an empty stomach? And so he said, okay, I'll do it before I work out tomorrow. He did. And He went from 45 push-ups where he'd been stuck at for a year with one dose of ASEA. He said, he called me after his workout completely dumbfounded. He could almost not speak. And he said, "You're not going to guess how many I did." I said, "I don't know, 55. And he said, "No." He said, "I did 69, one dose of ASEA." And I've seen that in people over and over again. ASEA is powerful. It can be very powerful. Now, did he feel an amazing burst of energy like he could, leap tall buildings with a single bound? No, he didn't. But you know what? He didn't wear out. His energy just didn't go away. He just kept going and going. He said, "I got to 40," and he says, I thought, I ought to be getting tired by now. And he goes, "I got to 55 and thought, what the heck is going on?" So he kept going to 69, and he said that's where he hit the wall. There we go.
Well, that's a respectable wall to hit.
That's a respectable wall at 78.
Yeah. Yeah. Well, that's great. I'm going to skip over to Nelda, and then I want to come back, and I've got a few, anti-aging questions to address there. Nelda, you tell us your story. You said earlier that Steve and you were friends, and that you're a nurse, so you probably have some professional associations, I'm assuming.
Well, so this is what happened. I had a friend, I had met her, and she was amazing. So I just wanted to go back and thank her because she was just very phenomenal, very gracious. I went back. She had a sign on the door and it said, "I'll be out for a few weeks." So I called her and I said, "Lynn, is this a good time?" She said, "Yes." She said, "I'm being discharged from the hospital." She said, "I had a knee replacement." She said, "But my body has shut down. I have excruciating discomfort and there's nothing else they can do." So I had heard, being here in Lubbock, being a nurse, I knew of physicians. I'd heard of Dr. Dalton. And so I said, "You know what? I know a physician. Why don't you go see him? If he cannot help you, he'll refer you out." So she went to see him. And then I called her on the day that she went to see Dr. Dalton. And I said, "What did the physician say?" And she said, "He told me that my inflammatory markers were very elevated. And with the knee replacement, it was inflammation on top of inflammation, and her body just shut down. She couldn't even ambulate a few feet away from her chair, couldn't function, and her sister was threatening to shut her business down." So I said, "What else did the doctor say? What else did the physician say?" And she said, "He told me to start taking something in a blue bottle." And I was across, here in Lubbock, Texas, across town from her. And I said, "Spell it for me," because I couldn't see the bottle. So she spelled it for me. I said, "Spell it." And she said, ASEA. I said, "We need to get some of that." So we both ordered it and we started taking it, and she got her life back. And then for me, I just wanted energy and endurance, and it gave me that and so much more. But that was my introduction to it. So I saw what it was doing. And then I attended a local workshop that Leland and Dr. Dalton had here in Lubbock. And that's where I met Leland. Cannot hear you. You're muted.
You're muted, Lee.
I'll get unmuted. You're sorry. I was trying to be respectful of the background noises. Dr. Ray, would you come in? You have been a stalwart here, especially you've got a large group in America, but you're in Southeast Asia, Australia. Would you maybe give a brief intro into yourself for those who don't know you and how you got into this? Let's start with that.
Yes, thanks, Lee. Thanks. Nice to be with you, Nelda and Steve. It's also my first time. I've seen you at conventions, of course, but we haven't actually interacted. My quick story is I became a naturopath and a chiropractor post a naturopath chiropractor eliminating my asthma when I was 18 years of age. So I was pretty impressed with that experience. So I decided to be what he was. And I then practiced, having graduated some years later through all of that study, and practiced with that gentleman for over 40 plus years. I stopped counting then. It probably was closer to 45. So my whole life has been natural health, healing, from the natural medicine side, of course, I'm not licensed to prescribe any drug medications, and I don't mind not being. So that's been my side of the equation. So I spent all my years with herbal medicine, nutritional medicine, homeopathy, dry needling acupuncture in my musculoskeletal work, etc. And my introduction to ASEA came from another athlete. So beginning an athlete theme here, Steve, 5 times heavyweight karate champion of the world, gladiator Lorraine Bavard was a personal friend of mine, still is. And she'd mentioned it to me. And like Steve, I didn't pay a lot of attention. The first 2 years, I did not undertake any study of it. I kind of didn't believe it. Salt water from Salt Lake City. We all go through this, as Steve and Nelda have said. So it was 2 years later, which was in 2018, July, she came here to visit me on holiday with her 2 daughters in Phuket, Thailand. And I had a lot more free time. I basically retired, 3/4. I saw a few patients, not a lot. And I had a lot of free time. So I thought, okay, she's staying with me. Let me do the science work and do a bit of study on this. And very similar to Steve, I hadn't met Dr. Gary Samuelson, but I certainly watched his presentations and video recordings. And then I'm thinking, wow, there's something to this redox signaling. And then I realized it had only been discovered in 1998, nitric oxide. And I realised it was an unravelling new area of science and that I'd missed the boat a little. So once I then went into these I was swinging between the science and the testimonials, and the testimonials were nothing short of astounding, whether it was an athletic one or whether it was in health regards. So again, a little hard to believe some of those unbelievable results. So I would then just go into the science more and more until I was convinced enough I need to get on this. I'm into health. I'm happy to share anything that's going to help other people, and I need to be involved. In terms of, first, I want to be on it. So I got on it in July 2018. I've never stopped. I never will. And similar to Steve, I've also now supervised thousands of people around the world, and it's just a joy. It's a great joy and it's a great pleasure.
That it is.
It's a great story, and we appreciate you being here. The thing that's really interesting tonight is we've got a good cross section, from the healthcare side, physician, dentist, chiropractic, naturopath, nursing, and so this is a good mix, and we can tap into that. I want to go back to you, Dr. Steve. You talked about in 2010 attending an anti-aging thing. I'm assuming that was the 4A group that you were there with. I'm somewhat familiar with that group, but could you just speak, maybe generally about, what is anti-aging? What is, describe what redox is and how it relates to, wellness, anti-aging, being more resistant in recovery, rejuvenation. Could you kind of speak to the science? If someone came to you, like even a patient, and said, what is this stuff? Where would you start?
Well, I would start, it's cell signaling. And as we get older, as you know, we lose our signal. And so the example I like to use is, what's the difference between a 20-year-old knee and a 70-year-old knee? Well, most of the time, the 70-year-old knee is riddled with arthritis. Well, the DNA program is essentially unchanged from a 20-year-old to a 70-year-old. So why in the world does a 70-year-old suffer with arthritis and other problems? The answer boils down to redox signaling. The signal has to be loud enough in the body to cause those cells to activate to do what they're programmed to do. So we're not asking, redox signaling isn't asking the body to do anything unusual or weird. It's just asking it to perform and do what it's programmed to do. And that's what redox signaling it is. It's a messenger. And I could say if you have a teenager and you gently ask them to take out the trash and they don't, you can give them a louder signal and yell at them and they'll probably hop to it and get it done. It's a signal. We need a louder signal to get the job done. And we lose that signal in our bodies as we get older. It just becomes weaker and weaker.
Great. So How much of this have you incorporated into your practice? I mean, do you actively speak about it, or is it something more on the side?
I am very active about speaking about it medically. As far as I'm still in the trenches, so to speak, one-on-one patient care. What I do as an anti-aging regenerative medicine physician, I'm kind of like the knot at the end of the rope. When nobody else can get you well, you end up on my doorstep a lot of times. And there's people who just don't want to get sick, and they end up on my doorstep. So I present this to most of the patients most of the time, and of course it's up to them. And I always tell them it's your choice. I mean, you came to see me. Now you have to decide whether you're going to ignore me or follow my advice. And it's really up to them what they do. But I do give them the information. I do sell it through the office, and I do give them the opportunity to order it off my website. But that decision is theirs. I do use the Renew 28 on the neck at least almost every day in my clinic, and it's been really remarkable. It's a game changer for the patients that I do that for. They're just shocked at the results.
For those that don't know, how would you describe when you say regenerative medicine? That's speak to that, if you would.
Well, really, what we should be doing in medicine is reestablishing normal biology/physiology. If you can restore normal physiology, we don't need some sort of artificial man-made chemical to try to band-aid a symptom that we're having. That's the simplest way I can explain it. Now, anti-aging and regenerative medicine, we specialize in identifying the problem, correcting or normalizing the physiology. And medicine goes through a lot of changes, and not just medicine, a lot of things. So, for example, one of the examples I give is, 25 years ago, it was almost considered voodoo in the medical world to recommend probiotics or supplemental vitamin D because, we get enough and we don't need those bugs. Well, now everybody does it. But, that's fairly typical. The rest of the medical establishment, it takes an average of 17 years, according to a Harvard study, for the medical establishment to make it the standard of care of what's discovered 17 years earlier. We're slow to change. People are slow to change. We're all slow to change.
Yeah, that's a long pathway, isn't it?
That's a long pathway.
Yeah. Dr. Ray.
I mean, I couldn't agree more with Steve. I mean, you practice what you've been taught previously. When you're practicing today, you're practicing what you've learned yesteryear. So this was my issue, in fact, when I was first informed of redox. The fact is I wasn't taught redox, and I was actually lecturing at the time when I was introduced to it in the science department of the Australian College of Natural Medicine. And I was lecturing in anatomy and physiology and pathophysiology. The PhD biochemists were standing beside me teaching, and they weren't teaching redox signaling molecules, and that was up to 2017. So what Steve's example there is exactly correct. It'll be another 40, 50 years before mainstream medicine catches up with redox. Therein is how fortunate we are that we already have, fortunately, eventually paid enough attention to be able to experience these profound results and go on to share it.
True. And one thing I'd like to add, too, is that in the medical profession, whether that's naturopathic or allopathic or osteopathic medicine, as well as in nursing, we have the established protocols, and some of them aren't right. You have to unlearn what you're taught. And if you don't believe medicine is slow to change, I'll give you an example. It only took modern medicine 2,500 years to realize that bloodletting for illness wasn't good for the patient. Okay? And the guy who invented hand washing and proved that hand washing saved lives, he was kicked out of 2 hospitals and thrown in an insane asylum. So medicine is slow to change.
Absolutely.
Yeah, those are stark reminders. Nelda, could you come on? When you're talking with people, you have a good understanding of this. How do you present this to people? Because this is kind of strange. as Steve said, it was 2 months later, he was spending some money for salt water, and that just seemed like silliness. So how do you get past that, and what do you say?
Well, for me, I was seeing a lot of patients that take a lot of medications. I mean, anywhere from, I'm going to say 6 to 40. And then when I saw my friend that I had just met, when her body shut down, I already knew before that didn't want to be a patient that was taking a lot of medication that had side effects. I knew that I didn't want to be like that. But then when I saw that her body shut down, and then I thought, I need to see what I can do to help her. When she went in and found out about the bottle, the blue bottle, I wanted to start taking it for that reason, because I wanted preventative. I always want to be preventative and like take care of myself before something happens and not be behind the 8 ball. So that's really what I do. But when I share, I basically give people the experience. So I just meet someone and I really want to get to know them. I ask questions, but it's for whoever I meet. Like, I met this gentleman, I went to a meeting, he was there. I was wearing my SIA jacket and he just said, "What is a SIA?" So I basically said, "Cell signaling supplement." And I said, "We'll talk after the meeting," because it wasn't about redox. And so I just had my gel with me and I said, "Do you have any discomfort?" And so when he said yes, I said, "Let's apply it to the area." And so he applied it. I gave him that experience. And then that's really what happened. I sent him a tool, the video, Real Redox Results, the 10-minute video that we have. He watched it and they wanted to start on the product. And after that, he had great results that evening. But right after they began the product, it wasn't very long, he attended one of our workshops and he said, "I'm ready to get started." So that's kind of how simple I make it, because I know how easy it works. It works very rapidly. All you have to do is just swipe it on your neck. I do a core strength balance test, Dr. Lee, and show them how quickly it works. And once they see the results, they're like, "How do you get it?" And so that's kind of how I introduce it, and I love it. But the main thing is I ask a question, and most people, I'll just say, "How's your day going?" Or, they may have a basket full of vegetables and I'll say, "Are you into juicing?" "Yes, I am." Well, I already know that they're into their health. So most people that I meet, when they're into their health, they're already sharing something with me about themselves. And then they open up about, "Well, the reason I'm juicing is because I'm having this health issue." And then I say, "Have you heard of redox? I've been a nurse for 29 years. Have you heard of redox signaling molecules?" And then they say no, "Would it be okay if I show you how quickly it works? I have something that can help you. If I have something that can help you, would you want to know more about it?" And that's how the door opens up.
So, Steve, could you go back to the point you made earlier, saying why are because we get asked this all the time, how do you talk to your doctor? How do you kind of like get clearance or permission or get them interested in this? How would you approach that?
Well, the information is out there. As I've told a couple of physician friends of mine, you really need to know about it because you're going to be asked about it. And on top of that, once you find out and understand about it, you're going to wish you knew about it 10 years ago. Okay.
That's a really good point.
And I have to give a thumbs up to Nelda because, I wish I had a dozen Neldas on my team. Nelda's got a real gift of talking to people and interacting with people and sharing a SIA. And, that's where so many people fall short. They're a little nervous or a little scared or don't want somebody to tell them no. You can't be worried about if somebody tells you no. And Nelda, she really is, I wish I had 12 of them on my team, just like her. She's really got a gift.
So your approach with them is to say, almost as a self-preservation thing, is like, you don't want to look stupid when people come ask you these questions.
I mean, there's a lot of different ways to approach it. I mean, the strength and the balance test, the using the Renew 28 gel, when you get results immediately, I say, this is proof right here that your body is deficient. The fact that it worked and you had such a good result, you're deficient. If you want to throw something else in there, said if your thyroid is low, we replace your thyroid hormone. Well, your redox signaling is low, and we've just proved it's low, you ought to consider replacing it.
Right. Hey,
Physicians are a tough nut to crack. I'll just tell you that. Okay.
one, I was getting asked that question, so I was really interested in your response, because it's like, how do you go to your health professional and convince them? Because I'm not a physician, they are. How do you? It's not an equal playing ground.
Well, the way that most physicians get convinced or changed. So first of all, unfortunately, too many people suffer from a deplorable lack of curiosity, okay, in the physician world. So they have to be presented, in my opinion, with something that just goes beyond what they've been trained. So somebody gets a health result, is gluten-free, say has a medical condition that they're not supposed to be able to get rid of, that they get rid of, something to pique their interest. See something happen or reverse that's not supposed to be reversible. That's a way to get their attention. And, I could tell a colleague, a patient might not be able to, I see people get well with this all the time, but they have to be interested. And all I can do is extend the hand of opportunity, but they have to be willing to, accept an invitation, willing to know.
Yeah, that's a really good point, Ray.
Results. It's the same as Nelda sharing it, results. It's the same with physicians. The best way you can introduce it to your doctor is use it, get results, and then show your results to the doctor. The doctor will soon see the results when you've given it 3 to 6 months. And then they're going to start saying, wow, you're doing really well on my treatment. you might want to let them know what you've been doing for the last 6 months, because it's always results driven, whether it's the physician trying it and getting a result, or whether it's the patients introducing them to, I'm taking a new supplement, redox signaling molecules, and wow, I've had this experience, I'm sleeping better, I have more energy. And are you aware of that, doctor? And that goes back to circle to what Steve said before, even as a doctor introducing other doctors. You need to know about this because your patients are going to ask you.
And you said that very well, Dr. Dixon. Results. Results speak for themselves.
Absolutely. Yeah.
Okay, so
it's all about results.
Let's play the devil's advocate a little bit here, because we're a medical panel, right? We've got degrees in healthcare. And let's peel the onion just a bit and just say, okay, results, but it could be placebo, it could be mind over body, whatever. So if we peel the onion back, Ray, let's start with you. Describe, if you would, for those who have that inquiring, they are curious. They deplorably incurious. But what is it that what's the science? Give me something that I can chew on.
Well, I go back to the first discovery of redox signaling molecules, nitric oxide, 1998. It regulates blood pressure in the human body, and that profound discovery gave rise to other drugs, famously known as Viagra. So that kind of gets their attention. It's a new discovery. I always say 20 years in medical science is like yesterday. So don't think something discovered 20 years ago the whole world knows about, because it does not. And Steve exampled that very well with the Harvard study taking 17 years to filter down at least. So I mentioned that, and I say they're made in the mitochondria of cells, which is the powerhouse. The average person doesn't know what the mitochondria is, but you can name it: mitochondria, powerhouse of the cell, energy's made there in the same cycle. And it depends who I'm talking to. As Steve and Nelda said, if it's medical, I'll use more medical terms. If it's lay, I won't use the medical terms. I'll just say there's energy made in the mitochondria of all cells, and in that process, we make a whole bunch of these redox signaling molecules. We peak produce them at healthy puberty. The science has been in long before 20 years on mitochondrial efficiency to body size and peak production, and that's puberty. So we're increasingly becoming deficient in these molecules as we age at the rate of 1% per annum, 10% per decade on average. If you have a healthy lifestyle with better diet and exercise and supplements, you might slow that down a little bit, but you can't cancel it out. And if you have a terrible lifestyle and you have many medications and you don't eat well and you put on too much weight, then you've just accelerated that decline beyond 1% per annum. So you're even more deficient. So the only way that you can bioreplenish those molecules that cells signal the need for healing, repair, recovery, and your immune system is also cells, and we need that functioning well to be able to take out any rogue cells to prevent you from developing rogue cell conditions. So that's what this is, and the only way that you can compensate completely for that lack as we age is with a bioreplenishment formula known as a C redox.
Hey, Steve.
Second part to the answer that you asked is there are now over 500,000 peer-reviewed medical journal articles on redox signaling. So it's in the literature. It's there.
Yeah.
The science is there. It's not up for discussion. It's there.
Correct.
So Steve, you're in this anti-aging rejuvenation, space professionally. Could you address, what is health span and lifespan? What's the difference? And discuss it from the point of view of like traditional medicine as well as from kind of what we're doing.
Well, a good way to put it is, and it's been said, we live too short and we die too long. Okay. And so, in anti-aging or regenerative medicine, we seek to expand not only the health span, but the lifespan. I mean, our life should burn brightly like a light bulb, and then at the very last second, it should flicker and go out, but we should burn bright until the very end. And that's kind of one of the goals we have. And there's a lot of research being poured into longevity, and there's a lot of things that are being done. There's a lot of new things that are coming out. If I told you some of the things I knew that were the technology that exists, okay, it would seem like something like Star Trek or fantasy, but some of those technologies exist. We're just not allowed to have them, and they're slowly eking out.
So what's the role of, say, allopathic medicine, traditional medicine with regards to health span, lifespan?
Traditional could be flipped around to the real herbs and the real dietary lifestyles too. So even traditional as a word has been flipped. But go ahead, Steve. Allopathic.
Well, I think it was Hippocrates who said, let your food be your medicine and medicine be your food. And we're coming right back around to that.
Exactly. Hippocrates was a naturopath, without a doubt.
Yes. So, I mean, I was trained in the allopathic model for sure. And, and basically there's a pill for every ill, and cold steel cures. So, if there's a problem, you cut it out. If not, you medicate it. But there's really, in all of the training I've had there, in the medical school and residency training, there was very, very little emphasis nor knowledge on how to actually prevent disease or reverse disease. It was always we were taught how to medicate, and medicate. And that's just the way it is. I mean, that's what's being taught.
I think, Lee, to be fair to allopathic, if I can, the whole antimicrobial therapies in terms of drug medications for bacteria, viruses, fungi, I think, and emergency medicine, I think there's no competition with allopathic from any other. There's help to be had from a dietary, lifestyle, redox point of view, but from profound effects and therefore helping people to live longer and healthier and survive infections. There's no competition with allopathic medicine. And the same in emergency medicine. Extraordinary care to be had and to help us to live and survive. Beyond that, as Steve has said, a drug for everything, be it pain, whatever, they're not healers. they are relievers and alleviators of signs and symptoms with side effects. So, the upside is you might cope a little better, but the downside is you're not healing and you're not reversing and you're not recovering and you're not anti-aging either. So just to be fair there and get that balanced perspective, I think the extraordinary part of allopathic medicine development in these last hundreds of years has been antimicrobial, in my own personal view.
And then allopathic medicine really shines when it comes to acute care, car wrecks, broken bones, acute life-threatening illnesses. I mean,
Yes.
Allopathic medicine shines, but it's not something that you want to particularly stay with for any sort of long-term chronic medical problem. And that's where the majority of medicine falls short, is in the management of chronic disease. But acute disease, I'd say that, trauma, there's no better place to be than going to the hospital and getting taken care of.
100%.
Hey, Nelda, when people get with you in this and they say it doesn't work, it hasn't helped them, how do you respond to that?
Well, I ask questions because most of the time, first of all, we know that scientifically it's impossible for it not to work. It's working even though if you don't feel that it's working. You may be thinking, well, I wanted it to get rid of one thing and it's working on something else and you're not aware of it. So I like for them to use the health tracker that comes in when you receive the product. That's important because you're evaluating where you are, because sometimes you forget why you started taking it and then that symptom went away or whatever, that discomfort went away and you forgot that you had it. The other thing, I just ask questions because most people may not be taking it correctly. They're not taking it every day. They're not taking the right amount. They might and they may be mixing it or taking it with food or mixing it with a juice or something. So I just ask questions and I'll just say, okay, Steve, are you taking, tell me how much you take per day. Instead of me saying, are you taking this amount? I'll say, tell me what your routine is. Well, I get up in the morning and I drink my coffee and I mix it with my coffee, or I drink my coffee with my, my molecules. And I'm like, okay, and so I listen to what they're saying because it's not going to work if you mix it with anything else. So I ask questions. And then most of the time it's that they're like, well, when you call back and you're doing a follow-up, I'll say, how much are you taking? They let me know. And then they'll say, well, I haven't even touched it. I haven't even opened it. So it's important to send the redoxguide.com. And there's a lot of frequently asked questions, and then ask them what questions they have just to make sure they're taking it daily, and I always say start with a small dose because you don't have to start with a large amount, especially if you have a lot of inflammation. You start with a small dose and then you up it, then you double it every 2 days. It's according to, your sponsor, how they want to walk you through it. But that's what I usually do. I'll say, try, if your body is very sensitive, you already know that. So you want to start with a small amount, maybe 1 ounce in the morning, 1 ounce at night. I have one friend, she could only take a spray, just a little spray to begin with. Had another guy, he started and he said, I can't take it because of the taste. And we know that most of the time you have a lot of toxins in your body, you need a rebalance. And so you want to start off slow. So there's a lot of different ways to take it, but asking questions, making sure they're taking the right amount, start off slow, take some in the morning, take some at night, and then double it every 2 days until you get your aha moment and find your Cinderella dose. That's what I do. But most of the time when people say it didn't work, I ask questions because there's something missing in the picture. That's what I would say about that.
Now, you certainly can't just put it under your pillow and expect it to work, right?
Exactly. No, and you don't want to drink it out of this bottle because they may be doing that and so you're getting a backwash. So I always just say, first of all, start off with a little bit, just take some and then just drink it, in the morning. And then this little glass, you don't just put it right back and use it at night. I say wash it out, clean it, dry it so that it's clean. And so that's what I do. And so that's what I recommend.
You need to get enough of it for long enough.
Right.
It's not about, is it working? Is it not working? As we know, the science absolutely proves it's working. Working, what is the definition? It's interpretive. People are interpreting work to mean I feel better, my headaches are gone, my discomfort's much relieved. That's how people assess working, because they're used to signs and symptoms and responses on signs and symptoms. Of course, it's working, or we wouldn't even be having this conversation. Every cell runs on redox signaling molecules. As Dr. Lee, who's written the prime book, Redox Matters, well describes, the redoxome underpins the genome. The DNA, the genes are run by redox signaling molecules. So, of course, it's working, or you would be dead. The difference is when we add the supplement, we now are looking at working as a result, a change in our obvious signs and symptom physiology if you have signs and symptoms. So you will get results, but it's a matter of time and amount. Time and amount. Remember, the older you are, the more deficient you are. The more sick you are, the more deficient you are. Put those two things together and you can almost calibrate how much of this you're going to need. As Nelda said, we begin 1 or 2 cups a day, most people. The sweet spot, I like Nelda's Cinderella, the sweet spot's going to land between 4 to 6 of those a day for most people. That's where they're going to see they're going to feel. They know it's working for them. But, if we go to the other extreme, what's the most amount that we recommend in extreme conditions? It's the entire bottle. So that's 16 cups a day. So the worst conditions imaginable, that's where I'm going, up to a bottle a day. So there's your range. Your result, guaranteed, is in that range and over 3 to 6 months.
Hey, Steve, tell us about prevention. I heard a statement once that says, may we never know what we prevent. Speak to that if you would.
Yeah, you go, Steve.
All right. Well, it's a whole lot easier to prevent a forest fire than to put one out. Okay? So we never want to have that forest fire with our health. And, that's prevention. We want to, prevent a blood sugar issue, prevent, heart attack issues, those kind of things. It's much better to prevent than to treat.
So what you're saying, as I hear it, is if we go upstream, if we get into the foundation, if you will, if we correct the root cause, cellular dysfunction, what you're saying then is that we're not going to have, or we'll be disfavoring the development of the symptoms or the disease.
Right. Almost all disease can be linked to lower mitochondrial function, lower energy. When the energy gets lower, dysfunction becomes noticeable or happens. And so, as it has been explained before at some of the ASEA conferences, I ask people, anybody heard about being over the hill? Okay. So if you're over the hill, what ASEA does is it's high energy redox signaling molecules. It just pushes your body and your system back to the top of the hill so that you're not so far over the hill. So you've got a lot farther way to go before you hit bottom. Okay. It's like me and my gray hair. A lot of my gray hair went away. Most of it did, but I'm eventually going to lose the battle, but I'm going to fight it all the way.
That's a really important point, Lee. Exponentially, disease conditions worsen with age. That's every decade. You don't die healthy. Something fails. Whether it's heart failure, respiratory failure, whichever organ fails. So something will give in the end, but that's inevitable. So this goes back to your health span. You really want to maximize the functioning of your cells to the end. And Steve explained that very well before. So really the prevention is very, very significant. Prostate cancer in males exponentially increases with age every decade post 50, let alone 60. Do you want that? So may you never know what you've prevented. That may well be macular degeneration of the eyes sending you blind. That may well be a heart attack through atherosclerosis in your coronary arteries. That may well be losing your memory with dementia. Would you like to not have those conditions? Well, may you never know that you prevented them, because I can tell you, if you're not on ASEA redox, some of those conditions sadly are coming your way.
And I'd like to make a comment on the Acia Via line with the multivitamin that they sell. What's really important is what you eat is important, but what's more important than that is what you absorb. And that's the Acia Via multivitamin is all natural, plant-based, very easily absorbed and used by the body. And I can tell you, being in the trenches and seeing a number of patients every day, and many new patients each week, humanity's in trouble. When I started medicine, I'm just going to say over 30 years ago, because I really don't want to give away my age. Anyway, it was over 30 years ago. It was probably 1 in 30, 1 in 40, maybe 1 in 50 people who had a B12 deficiency. And at this point, I'm seeing 1 in 2 that walk through my door as a new patient. And there are people that have done thousands upon thousands and thousands of autopsies. And we all die of a deficiency disease. And when you're having a deficiency, disease is going to result eventually. Now, the Acia Redox it's got a nickname, Hope in a Tube, Miracle in a Bottle. It won't correct a B12 deficiency. You still need it. But everything that you do have in your system, in my opinion, it makes what you do have more efficient and work much better, even if you are in a deficiency state. Now, that's my opinion, and that's what I personally believe I've seen.
And I have too. But let me just say this, and the Redox will increase digestive capabilities and absorption capabilities. It will increase tight junctions in the gut and prevent leaky gut. It's known to increase enzyme production to enhance gastric phase, intestinal phase of digestion. So you are going to absorb more of your nutritional materials by being on the redox signaling molecule supplement. Now, having said that, I agree with Steve 100%. Nutritional inadequacies alone can't be corrected with redox. Redox will simply help absorption, and we do need quality supplements and a healthier diet, a more nutritionally dense diet, healthier food, organic food, and not denatured and full of chemicals. So we're on the same page here. And by the way, that multivitamin, that multi-nutritional that Steve's referring to in the Via line is called Source. Excellent product. Take it every day.
This, as we wind up, I think this is a good place. Maybe Nelda, you can pitch in on this one as we kind of go around one more time. Where we kind of wound up going or gravitating to here was about lifestyle, redox-based lifestyles. Could you comment on that, and then let's go around and make your kind of your closing arguments here as we finish up.
So the redox lifestyle, to me, like we said, you can't sit on the sofa and just be eating your Cheetos and drinking a Coke and thinking, I'm drinking my redox every day, I'm going to be doing great. That's not the way it works. The redox lifestyle is, taking your supplements, taking the supplements that are absorbed in the body, eating healthy, exercising, drinking plenty of water, getting enough sunshine, things like that. It's all incorporated as is in your book. And so that's why I love your book, because it really just lays it out, the redox lifestyle. And so that's what I like to tell people. You think that, and we see it a lot saying it didn't work. And that's why I ask questions, because they'll say, well, will it work with alcohol? Will it work if it doesn't matter what I eat? Is this still am I going to get the results that I'm looking for? And we all know what the answer is. And so those people usually don't stay on the product because their health is not their number one goal or focus. So that's what I would say. There is a redox lifestyle. It does matter what you do. And the people that really stay on the product are the people that care about their health and care about their redox lifestyle and their health.
Ray?
Well, if you want maximum, optimum health span, health until the end, but there's only really two main ways you can achieve that. Number one is supplement with Acia redox signaling molecule. It's number one. Because you need to get the lights turned on. You need to get that mitochondrial efficiency and cell signaling turned up as high as it possibly can be turned up. Secondarily, you need to supply the materials that those cells need. And you are cells. You're up to 100 trillion cells. It doesn't matter if it's your brain, your liver, your kidneys, your stomach. They're all cells. healthy cells, healthy you, malfunctioning, dysfunctioning cells, you are unhealthy, and you will then end up with a disease name on the end of that. So there's only two ways to have the healthy lifespan and the redox lifestyle. The redox lifestyle is just another name for a healthy lifespan. One, you need to maximize redox. Two, you need to maximize the materials that the cells need to function. And three, you need to stop putting in toxins and chemicals and waste adverse to human physiology. So, toxemia and innovation, philosophically, and natural healing are the two underpinning agents of sickness and disease. Innovation means a lack of energy. Toxemia means too many toxins. We're right at the coalface of that with redox. So supplement redox, firstly, primarily, then supplement materials to back it up, and then avoid things not good for you. We know what this is. It's in your book. We need to cut back on not just adverse chemical exposures, but too much sugar, etc. Most people know this. Unhealthy fats, etc. So if you do that, you will have your health span. And by the way, talking about prevention, if I can just quickly say, Lee, that's exactly what I'm doing. I have no known disease conditions. My blood pressure is 115 on 70. I have no issues known at all. And just remember that you don't know diseases as they develop. You only know them once they're diagnosed, which is 10 years later in many cases. So I'm doing 6 cups a day purely preventatively to optimize exactly that redox health span.
Great. Steve?
All right, two comments.
Pleasure to have you on. So finish that. Tell us about how you approach redox lifestyle.
Well, the body has been, God designed us quite amazingly, and it is a self-healing body. That's the way we're programmed. And so if we, one, give the body what it wants, two, don't poison it, it will heal itself. And sometimes it needs a little extra boost, and that boost is redox signaling. Gives it a little kick in the pants to the cells to do what they're programmed to do. Don't remember who, but you of course will have a much better result if you lead a healthy lifestyle. But even if you don't, you should get some results. It just won't be, the results won't be as good as if you have a healthy lifestyle to go along with it.
Yeah, that's profound. I thank you. As we close up tonight, I want to say thank you to Nelda and Steve and Dr. Ray for being with us tonight. I want to emphasize that there have been several questions that have come in the chat about, will it work for this or that, or is there a protocol for whatever? And hopefully what those who have been on the call tonight or listen to this in replay will realize is that we're not treating disease, we're treating cellular function. Steve made the comment that we have a body that was designed to self-heal. It's the body doing this work, and we're just assisting it in its job. I call that the inner doctor. We awaken the inner healer, as it were, because that's just part of how we're designed. So I appreciate everybody tuning in tonight. And if you were invited to watch this by someone who was encouraging you to learn more, I would encourage you to get back with that person and to ask them the right questions, do your due diligence as you feel need, but most importantly, give yourselves some of the help that they're calling for, and join with us and begin sharing this. This is an incredible opportunity to help the world, to help our families, to help ourselves to become more healthy. So I appreciate everybody being with us. Next week, we will have Russell Mariani with us. He is been with us many times. We'll be talking about gastrointestinal health. The week following that, we will have Hunter Dean. We'll have Jerem, who is our new CEO in ASEA, as well as Alan Noble will be with us. And that will be the 2 next weeks coming up. Again, everybody, appreciate you being with us. Go give some love to a friend, a neighbor, and to yourself. And be well and be healthy, and we'll see you next week. Thank you.
Thanks, Lee. Thanks,
Thank
Steve.
you.
Thanks,
Thank you,
Nelda.
guys.
Thank you.
You're welcome.